The call to the member for Wills.
Thank you, Deputy Speaker. It was Scott Morrison, the current Prime Minister, that cut aged care by $1.7 billion when he was Treasurer. And then in this recent budget, Deputy Speaker, they spend to paper over their political problems ahead of the upcoming election. They spend to cover their political tracks, not to invest in aged care or enact the much-needed reform enacting of the full recommendations of from the Royal Commission. This is an aged care crisis that we're seeing play out before us. It's a system that is in crisis. It's been let down by years of coalition cuts and mismanagement. And we've seen again in recent weeks that due to the embarrassingly low wages and number of hours on offer, workers are compelled to work in multiple care homes. And it was in November last year that the Morrison government returned to a position of allowing workers to work in multiple homes. They made that decision after it was suspended for a period of time because of the pandemic. Once again, shirking their responsibility, not thinking through the consequences. From the very early days of the pandemic last year, we saw the horrifying scenes in countries across the world, in many countries where the elderly bore the brunt of the deadly virus. Horrible pictures from Italy and Spain and other countries. And in April last year in Sydney, in our country, Sydney's Newmarch House outbreak took the lives of more than a dozen residents. So we saw this, Deputy Speaker. We saw it play out before us. We can't say we were not warned. The government should have learned from this. Yet, the coalition government dragged their feet in taking the steps necessary in the facilities, the aged care facilities, which are under their jurisdiction. They didn't order enough PPE. They didn't help aged care facilities prepare and give them the practical advice on infection control. They didn't mandate common sense controls like limits on workers working across multiple homes and they didn't put in mask mandates. In my own electorate of Wills, the St Basil's aged care facility saw 183 coronavirus cases and 44 deaths. 44 deaths in one aged care facility. And there were more than 650 aged care deaths in total during Victoria's second wave. Now, aged care is a federal responsibility. We know that. And the majority of the deaths that occurred in private aged care centres, which are under the responsibility of the federal government. At the height of the Victorian second wave, there were 1,923 cases in private facilities. In the public facilities, aged care facilities, the Victorian state government-run facilities, there were 6. Now, more than a year on, the federal government have botched the vaccine rollout, Deputy Speaker, and aged care residents are still at risk. How is this possible? It's been more than 3 months since our vaccine rollout started, yet we still only have 3.3% of Australians that are fully vaccinated against this deadly virus. In the United States, they're offering the Pfizer and Moderna vaccines to anyone over the age of 12. In the UK, I think it's some 59% of UK citizens are fully vaccinated. And here, we're struggling to get the vaccine to people in their 80s and their 90s. We're still struggling to get the vaccine to people who work within aged care. We're still struggling to get it to the frontline workers in healthcare. And the minister responsible was forced to admit that he has no idea, Deputy Speaker, how many aged care workers have been vaccinated. Couldn't get that number. With all the power of the government departments under his control, couldn't even get you that number. Well, it turns out, Deputy Speaker, that less than 10% of employees have been fully vaccinated, and it was actually left to Victoria to do a 5-day blitz to vaccinate healthcare workers. And yet, the minister says he's comfortable about how the rollout is going. That's what he said in Senate estimates. He's comfortable about how the rollout is going. Where there is no comfort, Deputy Speaker, to the families who are grieving, the minister is comfortable. Because this government and its ministers can't take responsibility, won't take responsibility. They won't show leadership. They can't demonstrate real leadership when the country so desperately needs them to do so. It's easy to be distracted by numbers and statistics, Deputy Speaker, but it's important we remember that in each aged care facility across this country, there are people that we have a responsibility to look after. They are our friends, our mothers, our fathers, our grandparents. One of my own constituents, Patrick, contacted my office just last week. His mother resides in a private aged care facility regulated by the federal government. His mother has dementia, and despite her agreeing to receive the vaccine, on the actual day when they came to give her the vaccine, she was confused and in her confusion declined the jab, didn't understand what was being told to her. When Patrick found out, he was told that she would be given her first dose when vaccine administrators came back in a few weeks with the second dose. Yet on that day, they didn't even try to give her the first dose. And now he's gone into this bureaucratic nightmare just to get his elderly mother vaccinated. It's been an uphill battle, Deputy Speaker. With the government's advice to Patrick that he try and get her to a GP or get a GP to come out to the facility, or to take her or for her to go to one of the hubs at the exhibition centre to get the shot. Can you imagine an elderly woman with dementia trying to navigate the exhibition centre in Melbourne? Is that really the best we can do? Now, Deputy Speaker, a future Labor government will actually deliver the care that is worthy of older Australians, the people who built this country, the people whose shoulders we stand on. And we'll do this by ensuring that every dollar spent in aged care goes to employing a guaranteed minimum level of nurses, assistants and carers, and to daily needs like decent food, rather than lining the pockets of the more unscrupulous providers. We'll also take the steps necessary to make sure the aged care sector is properly funded and is investing for the long term as our population ages. Deputy Speaker, providing the best care available to our elderly shouldn't be controversial, yet it is. On this side of the House, we believe in properly funding our aged care system. On this side of the House, we believe in keeping our elderly Australians and most vulnerable people safe. On this side of the House, we believe in investing in the long term to ensure all Australians know they will be able to retire and grow old safely and comfortably and in dignity. And Deputy Speaker, based on all the evidence I have seen, that we have seen over the past 14 months, as we look past all the PR spin and bluster from the Morrison government and his ministers, I don't think I can say the same for the coalition.
I thank the member for Wills.